Great people, welcome. Thank you for tuning in to this channel. Today, Isaac the Great is bringing in diagnosis and treatment of bipolar. As a counseling psychologist, these are some of the things that I've been dealing with in terms of patients and clients that come to my office and the hospital that I serve. And bipolar is one of the elements of mental disorders that people are grappling with, and it's very disturbing to some people. Actually, people have ended up labeling themselves or people labeling them because of bipolar. But the truth is that it's just like any other mental illness. If you get diagnosed, you learn to manage with it for your life. Great people like Martin Luther King Jr. had bipolar, and he accomplished a lot with all that. So don't feel like if you have that kind of an aspect, you are like somebody who is not quite okay. Somebody told me now, people now think like I'm a mad person. No, it's all part of the journey. So how do you diagnose bipolar? There's a tool we use for screening called Goldenberg Bipolar Spectrum Screening. And it just a few questions that we ask. And each question has a rating. There are actually 12 questions. And we may not go through all the ratings, but I'll give you an overview so that you can be able to see whether you could be having something similar to that. Of course, once you get the in that you could be having a battle with bipolar, the next thing to do is to seek a professional help. Like myself, I'll be sharing my contact later at the end of this video so that you can be able to come and we talk and see, we do the assessment one-on-one with you and look at how we can manage and treat this issue. So we ask this question. For example, at times I am much more talkative or speak much faster than usual. Then you tick out of this, there's some rating 1 to 5, you tick whichever appropriate is you. A second question is, there have been times when I was more active and or did more things than usual. You're a bit active than usual. Then I get into moods where I feel very speed up or irritable. Has that happened to you? You tick according to the different rating. Number 4, there has been times when I felt both high or elated or low depressed at the same time. You feel like you are depressed and you are so high at the same time. You wonder what is happening. You tick how this often happens. Number 5, at times I have been much more interested in sex than usual. You find your sex drive is so high than usual. This happens a lot to some people. So you tick where appropriate. Number 6, my self-confidence ranges from great self-doubt to equally great overconfidence. Does that happen? You tick where appropriate. And number 7, there has been great variation in the quality and the quality of my work. At your workplace, as your employer talked about this issue and complained that you are either not doing well or sometimes you work and overwork yourself and that what is happening? So great variation. And number 8 is, for no apparent reason, sometimes I'm very angry and hostile. Our people either commented that you are very angry, you are very hostile. You tick appropriately. I have periods of mental dullness and other periods of very creative thinking. That happens a lot with somebody battling with bipolar. You have flight of ideas and so many things going on in your mind. At the same time, you have mental dullness. You don't know what you are thinking. You cannot say this is what I'm thinking about. Number 10, at times I'm greatly interested in being with people, and other times I just want to be left alone with my thoughts. Has that happened to you? We tick where appropriate. Number 11, I had periods of great optimism and periods of great pessimism. You feel like giving up. You feel like, oh, I think it's not worth. Or sometimes you are very optimistic about life. And lastly, I have periods of tearfulness and crying. Other times when I laugh and joke excessively. Could this be something that has been happening to your life for the last 1 month, 1 year, 2 years, 3 years? Could this be describing you? The best thing that you can do is not to feel like you have been diagnosed bipolar. The best thing is to do is to seek a professional. You go through this and other tests to confirm indeed you are bipolar. So what do you do? When you do that, then the next thing is to get help. How do we manage bipolar? Number 1, through psychotherapy. Through counseling, we are able to let you know that it is okay to have those feelings. It is okay to have that point of view, feel like you're down. And can't say it counseling, there's something we call learning how to cope. We look at who are the people around you who can be supportive to you, can help you to walk the journey and understand you without judging you on what is happening. Number three, something very important, we look at how do you develop better coping mechanism. For example, when you have a lot of energy, what can you be able to do? When you are very low, what can you avoid so that you don't mess yourself up? And lastly, if psychotherapy will not work effectively, then there is also what we call mood stabilizers. When your mood is so low, you get some mood boosters and something will bring your mood up. If you are very high, you also get some things that will bring your reactivity a bit low. So get in touch with me. Kindly subscribe to this channel and get in touch with me. You get my contacts. Let's hear your comments, your likes, and out of that, I'll be able to help you further. Get in touch with me. This is Isaac the Great, your counseling psychologist. Thank you.